was Friday morning is when I got the call. And for the rest of that day, it was like living in a Salvador Dali painting. Everything was just so surreal, or getting pushed through the looking glass. There was nothing that made sense to me anymore.
A breast cancer diagnosis was a blur for Marianne Sarkich. Somewhere in her medical records, a few words, dense breasts, appeared.
I knew so little that it just flew away. I did nothing with that information.
Today, a survivor, a patient advocate, and a mom, she won't let those words fly past anyone else. About 40% of women have dense breasts. You can't tell from size, shape, or appearance. It can only be determined with a mammogram. But having dense breasts increases your risk of cancer and can hide tumors on a mammogram, something we first reported about in 2021. Thanks to an FDA requirement now in effect, universal language will reach every woman, telling her if she has dense breasts and why it matters. How monumental is the change when you look at the landscape of early detection?
I think that's pivotal. The new rule is a wonderful first step, because we've had nothing across the country yet.
The FDA's requirement will also inform women that other imaging tests like ultrasound or MRI may help find cancers that could be missed with a mammogram. It's something Sarkich says can spark crucial conversations with doctors.
We are not cookie cutters. We don't need the same thing. And then to also know that you get the right screening test for your density. That's very important.
But I think it's a new day here in terms of looking at what is life-saving for women.
Congresswoman Rosa DeLauro has dense breast tissue. She gets an MRI every year in addition to her mammogram. It's why she's pushing to make sure all insurance policies cover those additional screenings to see what mammograms cannot in dense breast tissue.
We need to nationalize this. There needs to be the national standard. There needs to be the mandate to the insurance companies that they have to cover this. And so we are not looking at a patchwork where, depending on your zip code, that then your life can be saved. That's unconscionable.
Her bipartisan Find It Early Act was introduced last year, but hasn't advanced. Sarkich isn't losing hope.
There are so many advocates behind this new FDA rule, and so much work that they did to get to this point, to get the Find It Early Act even introduced, that we will get there. We are good at moving mountains, but it just takes some time.
While a few states will cover secondary screening, most do not. Representative DeLauro says that is unacceptable, that all women don't have access coast to coast. She says it's something she's going to continue to fight for. For Spotlight on America, I'm Lisa Fletcher.